Hello, how are you? My name is Winnie Barawa and welcome in our class. I will be discussing health planning cycle. This is Medic Academy, and if you're new, remember to subscribe. If you're a returning student, kindly enjoy until the end. So, in our previous class where we defined planning as a process that allows us to put potential outcomes in regards to activities that we wish to implement, planning in itself is a process. And because it's a process, it is actually organized in such a way that we have a cycle. And this cycle involves a step-by-step planning or activities that will lead us into having our final plan that will now be guiding the activities that we'll implement. So we have the first part, that is situation analysis. Then we go into problem prioritization and analysis, setting of goals, objectives, and targets, formulation of interventions, determining resource allocations, preparation of the action plans and budget, and the last bit is the monitoring and evaluation. So when we do this in a systematic way, then we end up with a cycle, because at the level of monitoring and evaluation, you can always find new unmet needs that can lead us into conducting a situation analysis again. So in the planning cycle, or rather in this class, what we will discuss is we will focus on situation analysis, then we will move into priority setting. We will therefore discuss again on formulation of goals, objectives, and targets, determining resource allocations, implementation of the plans and matrix, costing and budgeting, and then we will finish on monitoring and evaluation. And this at that time will then mark the end of our cycle or stages that make up the planning cycle. And just to remind us, the planning that we are focusing on here is health planning. So let's start with step one, where we said this begins with situation analysis. So by definition, situation analysis involves a process of gathering and analyzing information that will help us to design, implement, and evaluate the interventions. So it's like you're looking at what is ongoing, how is it happening, where is it happening, what are the problems, what are the resources, and what strategies can you come with. So the type of information that we are looking at that will help us design our interventions will be gathering using common questions where we talk about what is the problem, for instance, here, and who is being affected by this problem, why, or rather, what is causing the problem, how is the problem happening itself, what is the description of its, of its nature, where, that is the location of where the problem is existing. And then you check on different aspects. How severe is it? How much resources will be needed if we are to solve the problem? Which strategies can we do? So situation analysis expounds on the information, or rather expounds on on the situation by looking at information that surrounds it, and then you come up with resources and strategies that can be used to implement it. So there are basic steps that you can use in conducting situation analysis, and these are three. We have the first one on problem identification. Number two is problem analysis, and then number three is setting a priority. So in the steps of situation analysis with problem identification, we are simply looking at what is happening at that particular time. And then upon identifying the problem, you then analyze the problem in detail. So what, who, why, how, where, how severe is it, resources, strategies. And then once you've gathered all these questions that are helping us probe and get as much data as possible, we then set the priority. So in setting the priorities, we are saying in all this information that we've gathered and find a conclusion on what to do, we are going to start at this particular. So how many methods can we do to conduct situation analysis? Just like in the planning in the planning of our in our planning process, approaches were used and they were a bit different. So in conducting of situation analysis, you can use review of previous plans and documents. So you can use different documents to help us understand situation at that particular time. You can review policy documents from the ministry or from the government department. You can review previous plans that were already implemented and you want to understand how far they have been done and what was not implemented. It's rather more of like looking at where did we stop before we can resume from that particular point. So the other methods that we can use are the method involving pestle or epistle methods. And this is a criteria that evaluates the presence and the past states in the different states here that are stated. So for example, pest analysis, it's a method that uses past and present information in regards to political, economic, social, and technological analysis, while pestle analysis looks at past and present situations in regards to political, economic, social, technological, environment, and legal analysis, while epistle methods evaluates environmental, political, informatics, social, technology, economic, and legal spaces. So why I'm mentioning this all at the same time is because these three are all related because they're handling the same thing. So when you're conducting the situation analysis, you are simply being guided and told you can look at which of these areas are strongly affecting the problem that we are analyzing here. So if it's political, economic, social, or technological, then you can focus on that and use the best analysis. If there's legal analysis or there's environmental, you will focus more on what is directly influencing the situation in that area. So with the pestle and the pistil methods, the focus is the different factors that can lead to situations or that can contribute to the current states in different problems. So it can vary from environmental, it can vary from politics, information, social technology, economy itself, and even legal systems. So all these can just bring a situation that can lead into a given need or problem or a case that needs to be solved. And the other analysis we can use to be able to assess our situation is SWOT analysis. And SWOT analysis looks at the arena of what are the strengths, what are the weaknesses, what are the opportunities, and which are the threats that are presenting themselves in a given situation that are presenting either a need or a case that needs to be handled by coming up with a health plan. So with all these methods, all of them will guide given management team that is working on the different needs to develop, a given health plan. But in analyzing the situation, you can employ any of them. So let's focus on the SWOT analysis because at least this is the one that is a bit detailed and very key in most organizations. So SWOT analysis, we've said it has the part of strength, weakness, opportunities, and threats. So what is a strength in an organization that is very key? So we are told strengths are normally treated as internal. So there are internal situations. And what these things mean is those are the situations that do well. What is here that is happening correctly in the internal part of the organization? So it could be our high value of performance points. For example, good leadership, strategic insights, customer involvement and intelligence, good reputations and review, high skill workforce. All these are internal strengths that are leading to the organization being able to meet its objectives. Then on the other side, you need to know in the opposite of strength, we have weaknesses. So weaknesses are also viewed as internal, but these are treated as situations that prevent the organization from doing really well. So with the strength, we are saying situations that are making the organization perform very well. But with weakness, it's situations inside the organizations that is preventing it from performing well. So these weaknesses can vary from bad leadership, unskilled workforces, insufficient resources, poor product quality, slow distribution and delivery channels, outdated technologies, lack of proper plans. All these are possible weaknesses that can affect an organization. So as you're analyzing the internal environment, you can analyze the organization internal environment in matters of strength and in the view of weaknesses. And then when it comes to opportunities, we treat this as external factors. And what you look at are potential areas that can promote growth and higher performance for organizations. So you could look at areas, for example, economically, how is the country economy performing that can promote organization growth? Do we have things like low taxation? Do we have things like tax exemptions? These are opportunities that can increase the growth of an organization and propel its performance. And the opposite of opportunities, which is also external, is the threats. So the threats could be external challenges that are confronting the organization. So for example, politics, insecurity, increase in taxes, inflation. These are threats that can actually confront and make an organization perform poorly, but from the external environment. So now what happens is we are told in cases where we have opportunity and threats, it's the organization management committee responsibility to come up with ways on how we can either take advantage of these threats and come up with an innovative way to cushion the organizations, or use the chance of opportunities and develop new strategies to propel the organization further. And step 2 in the planning is priority setting. So with priority setting, we are able to sit down here now and decide, this needs to be done now or do we do it later? So we are looking at what is important that needs to be put in place. So priority here is on the terms of prioritization, where we are able to identify focal problems or need that target the group to, I mean that's the or need that the target group considers to be most critical, crucial. So looking at focal problem means or need, it means what is there that needs to be done as at right there and there. So you consider what is critical and work around on how to implement it. And then how can the team come with a priority goal or target? So mostly here it's done by developing a problem tree. And this problem tree will have hierarchy of all the possible problems in terms of understanding the relationship, that is the cause and effect. So if you have a problem tree, then you can say there is high mortality rates due to, so the cause and the effects. And this high mortality rate will have a certain effect in this particular area. So you prioritize, have a problem tree, and put the problem in order of what is key, what is focal, and how do we ensure that we meet all these particular needs in order of what is needed now or later. So with priority setting, you need to at least have a tool that will help us come up with, better better ways of putting the priorities in order. So we are able to rank the different problem using a matrix. So what you call the priority matrix table. So the priority matrix table is able to rank the different health problem in order of importance using a criteria. So the priority ranking can say, this is my problem number 1, or this is my problem number 2, number 3, and 4. So you're told as you're putting your problems, kindly make sure you put the focal one at the top and move to the least prioritized one downward. So at number 1, you will put the most priority problem that you want to solve. And then this priority problem, you are now able to evaluate it in terms of the different criteria that are highlighted here. So you can look at magnitude, severity, public demand, impact in terms of population who are poor and vulnerable, social disruption, technological visibility, cost effectiveness. So as you are able to do the priority matrix table, you are also checking this against these given factors here. So with the priority table, you're simply looking at what is key that I need to start on and what are the possible relationship in terms of magnitude, severity, and public demand. So I will mention this one by one in my next slide. So here it is. We've mentioned that you want to criteria these problems based on the different factors. So for example, magnitude, what does it do? Magnitude describes how big the problem is. So if a problem is big and it's affecting, let's say, a bigger population, could be maybe a problem is affecting both women, children, elderly, men and women, like it's complicated. So where a problem is big in terms of the population it affects, then you're really told you need to put that on a high priority level. Look at the severity and danger. Severity and danger asks the question, how serious is the condition? What are the major threats that the situation is creating at that particular moment? So where the severity is very chronic, then the problem is treated as priority problem. Responsiveness to interventions, and that is what we call feasibility. If a problem is not responsive to intervention, then you are told to not include it. Why are we saying this? Is because sometimes we may put an intervention or we may put an intervention to try solve a problem, yet this problem may not be cleared using that particular intervention. So if you have evaluated and realized that this particular problem is not responding to the given interventions, then it's not worth it including it in the priority set. And the other aspect we can do is the cost effectiveness. Is it financially worth it? We do not want to allocate so much money in a given intervention and yet it's not cost effective. We don't want to budget a lot in terms of looking at a problem that will not be cost effective. And the other part is political expediency, where we are saying, does that particular problem command a political authority? Because we need to appreciate that it's politics that actually allows problems to be solved. And it's the legal system, the political system that have a central play when it comes to resource allocations. So if a certain problem does not garner any political attention, then sometimes it's not worth it giving it all the priority in your list. So if you know you will table the given problem in the parliament or you will table it in your government authorities and they do not see it as a priority list, then it's always advised to not include it. So the priority settings are a bit many when it comes to criteria, but most of it is you will evaluate the problems you have identified based on the various criteria here, from magnitude, severity, response to interventions, cost effectiveness, political expediency, technological disruptions. All those are possible criteria to use. And we are on step 3, where we are formulating goals, objectives, and targets. So let's define first what a goal is. So a goal is a broad description of a desired end result, and most it describes the future end state or the desired outcome that is supportive of the mission and vision of the organization. So the goal is mostly long term, covers a bigger period of time or a longer period of time. While on the other side, an objective is a statement that describes an outcome of what the organization wishes to achieve or time frame within which it should be achieved. For example, you can say my objective is to develop a smart technology that can reduce the reporting time for patients. So now with the objectives, it is quite statement that is describing more of what the goal you're looking at. So we're saying a good objective is supposed to be smart, and that is a good objective should be specific, measurable, attainable, realistic, and time bound. So you have to ensure that your objectives look smart, can be measured, can be attained, is realistic in terms of what you're saying, it is time bound. Given a period of time, it can be achieved. So a goal is broad. An objective is specific and highlights a specific outcome that you want to achieve. Most of the time, the time frame for an objective is short, while that one for a goal is very long. So let's see what is the difference between these two. So an objective and a goal, they're not the same. But of course, we have said both of them are describing an outcome. That's the common area here for both of them. They are all describing an outcome or what you desire to achieve. So starting at a goal, we are saying a goal is very short but has very few words, while objectives are a bit longer and describe more. So they are more descriptive and long. Goals short with few words. Goals, on the other side, they're very broad in terms of scope, but objectives very narrow or specific in their scope. The goals, they directly support the mission and the vision of the statement. So they directly relate to what is the mission of the organization or the mission of the management team. But the objectives, we say, they indirectly relates to the mission statement. So they're supporting the mission statement, but they're not directly stating it. They are only bringing that through specifying what you're planning to achieve. So they are indirectly, but at the end of the day, this objective that you're looking at will help in building the mission of the organization at the end of the day. Goals covers long period of time, can be as long as 10 years and above. Objectives cover short period of time, can be like a 1 year case, 6 months, 2 weeks. The period of objectives is not long. It only looks at which time can it be allocated. So if an objective is to be achieved in 1 week, that will still be an objective. But the goals are quite longer. A year plus is what we use. So a target is a commitment that we make to achieve a specific quality or level of service. So what a target does is quite specific because the agenda of a target is to enable service delivery to be very focused and measured well and to allow continuous improvement. So most of the time a target could either be long or short term. So what happens is, for example, where you have an objective of reducing maternal death or mortality, then your target will be, for example, to raise $1 million to ensure there is building of a maternal health facility or to build a specialized children department or so on, because it's very specific. And the targets, what they do is the main purpose is to ensure that services or service delivery is enhanced, properly catered for, and everyone is able to access these services. So target simply helps us to achieve the goals and objectives, and it drives the mission and vision of the organization. Upon setting goals and objectives, then at step 4, we formulate intervention and resource allocation. So we are being told that there are criteria we've come up with and said, how do we prioritize? So we have done severity checks, magnitude checks, and we are now convinced that certain interventions can be put in place to help us solve this problem. But we are being told interventions that have very strong political will should be included in our plans. But also, we are being told that some interventions that have constraints and they are not feasible should be dropped. So do not bring in an intervention that has no political support. Reason being, the sustainability of these interventions may not be possible. But at the end of the day, also, if the intervention has certain constraints that will hinder its feasibility, then you rather not carry forward with it or start allocating resources to it. So having understood how intervention should be checked on, with the criterias, look at now resource allocations. So resource allocation establishes what needs to be used to ensure the interventions are done. So here we are being told we need to at least register a resource inventory table that has all the existing resources that we already have, looks at additional resources that we will need, and then looks at the total resources that now will make up the allocations that we will require for us to intervene. So with the inventory table, you specify existing, additional, and total. So for example, if in our resources we will need human labor, this is human resource, how many do you need? What are the materials? And so on. What amount of money and space do we have time Is there any research and information that we need to collect before we move forward and do the interventions? So these are very key stages as you're moving forward that will actually lead us into the implementation level for our intervention. The fifth stage is preparation of the action plan, or also what we call implementation plan. Now, this is a list of what the committee will be using to establish the different interventions that we are going to work on. So an action plan describes the specific steps that will be taken to achieve the initiative and strategic objectives. So this could be a list of activities, a list of the do's and don'ts, locations of where the activities are going to be. So they are very specific. They state what you are going to do to achieve a given objective. So you realize that they describe who does what, when will it be completed, how the organization knows the steps that are complete. So the action plan, most of the time, it's a very elaborate document. It has what is to be done, who is to do it, when, and what will show that the activity has been completed. So let me show you an example of how an action plan looks like. So here's an example of an action plan. Just like we've said, it has a list of what you want to do. It has a list of who will do it, and what will show that this activity have actually been done completely. So this is a committee plan that they were developing for different areas in their given location. In the areas here, for example, they had policy formulation and strategic planning. So they had the specific output. So like here you write, what do you expect to do? Let's say you're saying to develop a policy document in regards to, for example, gender discrimination. So activities, what are you going to do? Maybe create awareness, have stakeholder meetings, advise the government on this and this. And then on inputs is what resources will you need? Okay, I will need maybe an advisor, I will need this person, I will need all this. Who is responsible? You bring in the person who will spearheading this work. What should we assume here? So assumption is anything that you think exists but can also promote or demoralize your areas of focus. So for example, assumption could be, we assume the government offices will be receptive to your idea. What will indicate that the work has been done? So what are the indicators? Maybe you can talk about minutes. So in the meetings you're attending, my indicator will be a minute we've attended. You can also talk about feedback forms. But the output is, did you formulate the policy document? You can say about how much do you need? What is the budget allocation for this? So the action plan simply connects the activities that are to be done, connects who is responsible, what assumptions are there, what indicators will show the work has been done, what are the budgets, and all that. The columns might vary based on different project and committee criteria, but the components are still the same. You know, what you're planning to do, who, where, indicators, outputs, costing, and all that. And step 6 now, we've come up with a plan, but we need to do budgeting, costing and budget. So with costing and budgeting as a process, it's a way of costing input and activity in regards to monetary terms. So we are putting each and every activity we are planning to do in relation to how much will be needed, monetary terms. So most of the time you cost estimate. So that is, you look at activities and estimate or project what will be required in terms of how much for that particular activity. So you need to appreciate that the costs are of two types. You have recurrent cost, and then we have capital or developmental cost. So recurrent costs, these are costs that are incurred in a way that keeps running on. For example, if you have a project, then you need salaries. If maybe you're dealing with the hospital, you will need drugs, energy consumptions like kerosene and consumables. These are recurrent costs. You need to remember you will be paying them on a continuous basis or on a recurring basis. Could be quarterly, monthly, yearly, annually, and so on. Then capital or developmental cost, these are costs that are incurred on a fixed asset. For example, with capital costs, maybe you want to deliver certain products, you may need transport means. Now you can decide, I'm going to buy a delivery vehicles for that. Once the delivery vehicles have been bought, you don't need to buy a vehicle every year. Once that is done, it is done because it's already fixed. So it can be used as long as it is existing. So those are the few things you need to do. Budget, that is estimate what you will need in monetary terms for the various activities that you're looking at, but put in mind to appreciate that the activities you're looking at may generate either recurrent costs or capital cost. Recurrent cost, we are saying they will be recurring or will be expensed on at a repeat nature, either monthly, weekly, annually, quarterly, and so on. While capital developmental costs, these are costs that are incurred on a fixed state. Once have been incurred, they do not have to be incurred again. Our action plan is that you need to look at effectiveness. Is the plan effective? Is it meeting the goals and objective? Is it efficient and is it timely? So if you implement it, because now here we are taking the action plan as it is and putting it to work. So is it meeting the goals? That is effective. Efficiency, is it delivering these objectives within a reasonable timeline without any limitations? Timeliness, is it meeting our time target? If you wanted to do this action plan in 3 months, is it really working or we need to adjust? And the final stage, monitoring and evaluation. So monitoring is checking progress against our plan. We have been implementing the plan in step 7, and we've been putting each and every activity that we have planned for into reality now. But now you need to monitor, that is, check that progress against the plan. Are we moving or we've not achieved even one indicator or one output that we are looking at? So monitoring allows results, processes, and experiences to be documented. And this will later on help us in decision making and the learning process. So the data we will get in monitoring, we will use it now for our evaluation process. So by evaluation here, we mean the objective and systematic assessment of a completed project or program. So evaluation means we are appreciating that the project is either ongoing, the project has already completed, and this and what is the state of it. So the data we use to evaluate is obtained through monitoring level. So at the monitoring level, we check how the progress is ongoing, and then from the progress report, we will generate an evaluation report. So evaluation can be done at ongoing stage or it can be done at the completion stage. And there are specific aspects that you check when you're evaluating a project. And these could include relevance, effectiveness, efficiency, impact, and sustainability. Just like during implementation, we had efficiency, effectiveness, and timeliness. With evaluation, our key focus will be relevance. Was the project relevant, or rather, is the project relevant? Was the project effective, or is the project effective, efficient, impactful, and sustainable? So those are the key phases that you evaluate on. But you see, we have said with evaluation, you can do it while the project is ongoing or at a level where the project has been completed. So there are different levels where we can conduct an evaluation process. And one of it could be before implementation. Before implementation of the project, you can evaluate to assess the developmental needs or potential that can determine feasibility of the plan. So when you're doing the before evaluation is you want to see the ground state. How is it? Are there some obstacles that can hinder our visibility? And then you can come up with methods of overcoming that. The other evaluation we can do is what we call formative evaluation. So with formative evaluation, this one is done during implementation, and the main purpose is to identify areas for changes or modification. So because when the project is ongoing and it's not yet complete, but could be at the midline or 3/4 into it, you may realize that there are certain things that you need to make changes in. So the formative evaluation helps us to detect any deficiencies and allow us to redesign our strategies. If you discover there's a weakness, you can come up with a new way to strengthen it or to enhance the intervention that has been put in place. And the other one is summative. So summative, it's done at the end of a program to assess the program or project effect and outcome. This one you do it when now the project has completed, you are done, you are checking around your indicators and seeing that each has been done, but now you want to assess if the project was really effective or was it relevant. And at this summative level is when you come up with strategies to promote sustainability and further propulsion of the project after its completion. And the last evaluation level is comprehensive levels. At comprehensive level, we are told it's quite broad. It assesses so many things like the context, the inputs, processes, and also the outcome. However, comprehensive evaluation is said to be very demanding because this means we'll be evaluating each and every aspect of the project, and this can require us to have a lot of time or to use a lot of time and resources. And so this makes it very expensive. So that's why I realize most organizations or committees prefer to either engage in the summative or the formative evaluation because at least they're more specific, easy, and they're also short term. But they allow us still to get as much details as possible that we need to evaluate the program. So those are the levels that we need to know. We can do it before implementation, during where we talk about the formative, you can have it at the end where we mention the summative, and you can do it comprehensively, what you call the comprehensive evaluation. So thank you for staying with us to the end. And if you like our content, please subscribe, share, comment, and give us more input of what you wish us to share next time. So thank you. Bye bye. See you in our next class.